My name is Travis, for those of you that don't know me, from Arista, and this is Becca Christie from our team. We're going to bring you all up to speed on things for open enrollment for starting July 1st. I let the cat out of the bag for the people that are here in person that we come here with a bunch of good news. And so that's not always the case when you do these meetings, but the last several years have been good news. Most of what we're going to share today is going to be a lot of hard work from a leadership team on challenging us to find ways to give back to the employees through things that will help you become healthier, things that can help you with difficult situations, things that can put more money back in your pocket, which are all things that I think everybody can agree. We don't want to spend any more on insurance than we have to. I can certainly agree with you there. It's important to know that we work for y'all. We do not work for the insurance company. Okay, so we are your advocates. We're the ones that are kind of going out to the marketplace to make sure that we're holding everybody accountable. We're working with the leadership team to make sure things are good. But so what is open enrollment? This is kind of our time to hit the reset button. Whatever's happened in the past is kind of the past. So we have our benefits up until June 30th. And then effective 7/1, you have the benefits that are in this benefits guide. Okay. I'm going to refer back to a couple of pages because I know that this is such riveting information that you can't wait to like memorize all of it, but you're probably going to forget some of it. So page 4 and page 5 are going to be probably the most helpful pages for you to kind of go back to. There's information in this whole entire benefit guide that is useful. Okay. But in terms of like, what did he say and what are the kind of the super high level highlights, they're going to be on those pages. Okay. And a couple of different tools. We've got a benefits website we'll show you, but then also this benefits guide has probably got 90% of the questions you'll ever need. And this table of contents says, okay, I don't remember what Travis said about Welldyne. Who's Welldyne? Well, I can go to page 10, get everything I need. I don't remember who is our short-term disability provider. Go to page 18, right? So the idea is just to kind of refer back to this, but this is just an overview. And then for those of you that need more help, this is our team at Arista to help you guys. There's a telephone number, there's an email address. If you guys need help enrolling, you need just claim issues, you need help because you don't remember what we said, or there's any number of things that this stuff is, I know, like Morse code, right? Hard to memorize all of it. This next page, just an overview of the service providers, kind of right there at the beginning for you, so you know who to go to. And we'll go through who these people are in just a second. But like I said, going to start with page 4, and then Beck and I are going to hit some of the highlights for you. So we're going to continue to offer the same underlying insurance benefits as we did before. There's going to be some replacements for a couple things, like on the telemedicine side or the pharmacy benefit side. But in terms of like how your deductibles work, your copays work, what's covered, we're not changing anything. Okay. All these things meet the minimum requirements of the Affordable Care Act. So all those things are met. So when you're doing tax time, all those forms, everything works out just fine. But most of what we're going to talk about today is ways to make the process easier for you. So the first thing is Welldyne. Welldyne is not a name that you know. Your pharmacy benefits are through CVS, which is the owner of Meritain and Aetna, the insurance company, right? So your network, if you need access to doctors and stuff, is Aetna, right? Even though your card says Meritain, Meritain just processes the claims and that's your EOBs, but they're just owned by Aetna. CVS technically owns Aetna. It's a little integration that's happened with that. So we've looked at the data of your pharmacy benefits and found that we can source those benefits more effectively, thus keeping your costs down by moving over to Welldyne. Okay, so what does that mean? This is one of the most important things I'm going to say today. My mentor said you have to say things 7 times until you hear it the first time. So number 1 is you are getting a new ID card. I have lots of witnesses and I'm being recorded. So up until June 30th, your benefits are your benefits. What we're talking about today is what's starting on July 1st, right? So July 1st, these benefits kick in with all these enhancements we're talking about, Welldyne being one. Welldyne will have its logo on the back of your ID card. So right now it just says Meritain. On the back of that ID card, it will say Welldyne. They already work together behind the scenes. They know each other. They've got thousands of joint clients. It's just basically the people who do the behind the scenes work. It's called Welldyne. Your prior authorizations, you want to get details on your formulary, it just goes through Welldyne instead of CVS. You still have access to the same types of pharmacies you do today. The Walgreens, the CVS's, none of that's really changing. Now, what does change with pharmacy benefits? And this is what happens regardless if we were making a change or not, is your formulary, tier 1, 2, 3, right? That's constantly evolving. It's constantly changing. At least twice a year, they're changing stuff. We are aware that there are a few people impacted by the change to Welldyne. For example, some people are taking over-the-counter medicines and a prescription. Well, you can go get that stuff at Costco. So we're not going to include things that you can go get over the counter. We really shouldn't be anyways, right? But we have access to information. There is going to be a 90-day grace period. So if you are impacted by any of the changes, you'll be notified in advance, number one, okay? Number two is you don't have to make any changes the first 90 days. There's going to be a grace period to give you time to make a change from, let's say, drug A to drug B. Okay, so there's going to be time to work through the transition. But for number two, we are all getting a new ID card. Thank you for playing along. It's much more fun that way. Now, here's what I cannot guarantee you. Anybody been having any problem with the mail service lately? Yeah, me too. So I can tell you we're doing open enrollment much earlier than we normally do because we're trying to make sure ID cards get out in time. You will be in the system with benefits before July 1st. I can assure you. What I cannot assure you is that the mail is going to deliver your ID card on time. So we will have electronic copies. So if something happens, you can call our EBA line or we'll have an electronic copy to get you through the way. Okay. So we're going to be making this change effective July 1st. The second thing that we've been tasked with, and does anybody remember, you sure should, Healthcare Blue Book, right? Which is if you use this app and you go to the right kinds of doctors, it tells you more about how good they are and you get a financial reimbursement. Well, raise a challenge just to say, I want to do more. I want to push that more. Well, they don't allow us to do any more financially than the system. So we're going to be changing from Healthcare Blue Book to a company called Garner. Okay, there are some distinct differences, but what Garner is essentially high level is the same premise of Healthcare Blue Book. How do you know which doctor to go to? It's hard. Like we like to talk to our friends, we talk to our family, right? Yes. Did you join late? Okay. I thought I went over that. I'm sorry. So Welldyne is the pharmacy benefit manager. That's who handles the prescriptions and where you would log on to your formulary. It doesn't really have an impact for the vast majority of people. You're going to go to the same pharmacies, filling it at the same copays or cost structure. The behind the scenes stuff is why we're making the change. There are a couple of formulary changes. So if you're one of those people impacted, they will outreach to you. They might change you from drug A to drug B. I did very transparently say that we're not going to cover certain over-the-counter meds anymore because we really shouldn't be. But that kind of stuff was going to happen whether you stayed with CVS or you go to Welldyne. So you're not really going to see much of a difference, but it's going to say Welldyne on the back, and you have to go to Welldyne's website to get some information. That's really it. Okay. Back to Garner. Garner does the same thing conceptually as Healthcare Blue Book. Y'all know a lot about engineering, you know, but y'all don't know exactly how good a doctor is, right? And none of us really do. We do the best we can with the resources we have to ask questions, but Healthcare Blue Book was a tool to help you supplement that. Garner, basically what they're doing is they take all of your Aetna doctors. So you're going in network, right? We don't have to go through that. You should go in network, right? So they look at all the doctors and they say, who are the top 25% of doctors? We know that these people do a better job. They don't have readmission rates after surgeries. They don't have infections. Again, this is a voluntary program. You can go to any Aetna doctor you want. Everybody heard me, right? Nothing's changing with your doctors. Go to whoever you want. If you happen to go to a top 25 doctor, you can get up to $1,000 reimbursed for employee-only coverage and up to $2,000 for family. It's pretty material. The average person doesn't spend $1,000 a year in medical expenses. Average person. Okay. So it's possible that you would have no out-of-pocket costs other than the premiums that come out of your paycheck. You just have to have a little skin in the game to make sure that your doctor is. Now, I want to talk about a few things. It's going to cover your copays, your deductible, whatever you come out of pocket is eligible. Now you're going to ask me, what are all the gotchas? Because I'm just going to be transparent about it. You have to use the Garner app. They've got an app or a telephone number. If you hate apps, you don't want to download another app, you don't have to. But you have to engage with the app or with Garner proactively. Meaning, you have to use it before you go to the doctor. Everybody heard me, right? You have to use this before you go to the doctor. If you do, and you find out that the person you go to is a top provider and you put them in your profile, either on the telephone or through the website or through the app, then you're going to get reimbursed, for example, $25 copay. You're going to get reimbursed up to, let's say that, you had a surgery and the surgery was $3,000. You'll get $1,000 of that $3,000 back, just as an example. Okay, there's a couple technical things of how it works. I want to make sure that everybody understands. For those of you that like your pediatrician, you don't have to change it. For those of you that like your OBGYN, no problem. Far be it from us to tell you what you should do. There's an exception for that. And if you like your primary care physician, there's an exception for that. Sorry, pediatrician, primary care, OBGYN. Those three can be what's called grandfathered in. Let me explain exactly what that means. This is very important, okay? You have to call Garner or go on the app and put the doctors that you go to in the app. If you are like my family, our primary care physician, I typically go to the same one, but there's a practice with 3 other doctors, and I might go to another one. I would have to put all 3 of their names. Otherwise, only your doctor is going to be covered. You go to a pediatrician, and our pediatrician practice has 6 doctors. What do I have to do? I have to add all 6, because I don't make Liam go to the same pediatrician. Like if he's just got an earache, right? Like I don't really care who I go to. So what you have to do, and I know I've said it at least 3 times, you have to add every doctor in that practice for them to be grandfathered. You follow me? There is an ask from you in this process. We want you to go to the right providers because it's better for you, but we're going to grandfather in your primary care, your OBGYN, and your pediatrician. You just have to add all those doctors. If, for example, and I'm just being very transparent, I only added Liam's 1 doctor and he went to go see another one, do I get up to the $1,000 back? I do not. That's correct. This is really easy to do, but on the front end, you're going to have to spend 15, 20 minutes just calling them, getting registered, getting the doctor set up one time for those exceptions. This is for medical. Okay. So we're going to go into a little bit more Garner, but I'm just kind of being transparent about what it is, but that's meaningful dollars. So if I only went to like get a couple of regular prescriptions covered and a couple of doctor visits, and I put my doctor in as one of the qualified people, I got no out-of-pocket costs. You pay it up front and then you submit your claim on the back end and they pay you back. So let me explain that last part. For the first 90 days, you're going to have to just take a picture. You get your EOB from Meritain. It says what you did and how much it cost you, right? You go to the doctor and then you get this piece of paper called an explanation of benefits. You just have to take that, scan it on the app or send it in, and they get you a check within 30 days. Eventually, we're going to make that even go away. After about 60 to 90 days, we're just going to integrate it with technology behind the scenes. You don't have to do anything. They'll just know. They'll know if you use Garner, and they'll know what it is from Meritain. They just talk to each other, which makes it easier for y'all. But for 90 days, we're just asking as a transition that if you go to the doctor and have any of those services done, you just have to take a picture of it and submit it manually. Does that make sense? And then about 30 days later, you get the money. How do you get the money? You have to use Garner. And when do you have to use Garner? Before you go. If for some reason you go and you forgot, and you forgot to put the doctor in and you went to somebody else, you're not going to see the reimbursement of that money. Just one time. You're going to create what's called like a profile, like with Meritain, you log on, you only have to log into Meritain once to create your profile. So you're just going to log in one time, put your doctors. If your doctor changes, you'd want to go back in and change it. But that's it. There's no exception for specialists. You have to use the tool. So we're only grandfathering 3 people or 3 types of doctors. Why is that? We want to make sure if you go to a cardiologist or an ENT that you're going to one that is good. Again, you can go to any Aetna doctor you want, right? For the normal way the medical plan works, but you get the money back if it's a top 25% as recognized by Garner. Does that make sense? Best thing you should do is get on Garner and put your doctors in. Why give up free money? And honestly, you want to take care of yourself. And sometimes what your friends and family tell you isn't maybe necessarily the best person. Wouldn't it be nice to have some additional validation if you've got something you need to do, just to have, like my wife had hip surgery and she's young, but I used this app because I wanted to try it and see, and it just confirmed what research we did do independently. But this person was in a top 25% doctor. Low admission rates, no need for second surgeries. I mean, a hip replacement's a pretty big deal. It's a major event, right? You just have to add whoever your primary is. It doesn't.
If you're a new patient, they're not going to be grandfathered in. You have to be a current patient for them to be grandfathered in. 7-1.
Sure. Say again.
They have to be like, you have to be a current patient for them to be grandfathered in. So you're going to be, like, if you're a new patient at a primary care,
That's
then
not
they have to be
grandfathered.
the top 20%.
This is your existing providers, because what we're trying to do with your existing providers is make it easy on the transition. If you're wanting to go to somebody new, you should be picking somebody. If it were me, I would pick somebody that's top 25%. We can't make it totally easy for every single situation. We're just trying to make it as easy as possible to not disrupt. I don't actually know the answer to that question.
I would say
Can I-
if you've seen the provider before, I mean, I'll double check, but I would say if you've seen the provider before and you don't fill out their documents when you go there, you know what I mean, saying you're a new patient of theirs, then it would be able to be grandfathered in. So if
For
you,
July 1st.
for July 1st. But if you, I mean, if you're looking at a new provider, I would go ahead and choose the top 20%. I mean,
If you're looking for new providers, you should use
Yeah.
again, we're not forcing you to use the tool. But if you want the money back, you should use the tool, right? I mean, that's how they're going to look at it. If I went to see a cardiologist and I went into the tool and I looked at a top 25 doctor and they see that I went to a cardiologist, I get reimbursed. If I went into the tool and I decided not to go to that person and they're not 25, I just don't get the reimbursement.
we have a question. I think you're.
Can I ask a question, please?
Yes.
Actually, a suggestion. I'm not sure where people are, but I can hear Travis speaking. But if people are asking questions, we cannot hear the questions. If you could repeat those, Travis, that might be very helpful for the audience.
You got it. Yeah, this
Thank you,
room is
sir.
way too big to be able to hear it from my
Yeah, that's
laptop
great.
in the front.
Thank you, sir.
So some of the. Say that again for me. Yeah, the Garner is not excluding what type of service it is. All Garner is doing, guys, it's really this simple. Garner is just saying, who are the top 25% of doctors? That's it. Because doctors are telling us where to go. Go get your MRI there. Go get your X-ray there, right? So Garner is the one that is kind of the quarterback of our healthcare, is our doctor, right? They're the ones telling us where to go if we're going to have surgery or not. So the intention of Garner is to reimburse you for things that your doctor is driving that healthcare. Okay. So the question was, what happens if my doctor, who is a Garner doctor, sends me to an MRI facility? Is that an acceptable place? Yes, because your doctor is driving the care. They're going to send you in network. obviously, right? That's kind of a given here. I'm not trying to overcomplicate this, and I know it's new. That's why these are great questions.
We are gonna have a campaign on this
Correct.
because it is extra work and we want everyone to be able to use their HRA money that's provided to you by United Consulting. So we're gonna have an extended campaign. I think it'll be June or July, but there'll be additional meetings just on this product alone.
Okay. So more's coming, just to be efficient with time, because we're into this a fair amount. Let's talk about another enhancement. So again, Healthcare Blue Book is going to go away June 30th. It's replaced by Garner, right? But it's a better incentive program and it's first dollar and it covers more things for more people. So that we see that as a really great thing. The other one is Teledoc. So that's like telehealth. I've used it many times. I have Teledoc myself through Meritain. We're going to be substituting Teledoc for something called Text Care. It does the same thing, but it's better and it can include more people. So the way that works is if you are covered on the medical plan, you and your entire household are eligible for Text Care. Okay, what that is, you can text people, you can call, you can do the video chat, very similar to Teledoc. It's just a bit more comprehensive in terms of what it can do and how it can serve you. So if I get strep throat or my son gets an ear infection and I don't want to leave and go to Piedmont and pay for parking and get my son out of school and all the stuff that matters, you can just pick up the phone and use Teledoc through June 30th. Starting July 1st, we're moving it to a service provider called Text Care. There's additional information. There's a whole separate pages on Garner. There's separate pages on Text Care in this guide, but just know that it's a new number. And there's even a QR code. You can literally just scan the QR code. It opens your contacts, dumps the number and the information right in your phone. It's awesome. I've used it personally. They call you really quickly. They're awesome. Guess how much it costs you? Zero. The company's paying for the cost. Because we're trying to make healthcare access to you guys easier, right? It's hard enough to do our jobs and manage family, and the work-life balance is a tough thing. So the idea is use telehealth as much as you can, if anything, just for a redirection on, oh my gosh, what should I do? And then also what happens if you need to go to the CVS Minute Clinic? That also costs you zero if you're in the PPO plan. Can't cost you zero on the high deductible plan because that's an IRS rule. But we're trying to make access to healthcare easier and more affordable to employees, and that's been a key initiative from the leadership team here. Okay. Also, one of the things that TAM has been advocating for is an employee assistance program. While we've had one, we've increased the face-to-face visits from 3 to 5. People struggle with different things: aging parents, daycare for kids, mental health issues, et cetera. It's any number of things. But what's most important is that this is completely confidential. They can't violate patient rights. Your name is never given, nor what you'd be calling for to me, anyone at United Consulting, et cetera. It's completely confidential. All we find out is someone used it. That's it. That we don't get any other information. So if this is important to you, the fact that you've got these additional face-to-face visits is really helpful for people. I'm going to talk about what's staying the same, and I want you to talk about a couple of the other things. So enrollment, you're going to get a note from Employee Navigator, same system you enrolled in years past. It's kind of over here. You'll get a note, check your junk filter in case it goes to junk, but Employee Navigator should be coming out around noon today for you to go ahead and enroll. Looking at IT in the room, just in case people say it's not there. I know it went through last year, but a couple did go to junk. So I don't know if there's a way to whitelist it or not, to be honest, but Employee Navigator emails are safe. That's the mechanism for everybody to enroll. Please, 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 we're going to roll everybody's benefits over. So if you just like what you have, we're going to carry it forward. However, we've got some enhanced benefits on the life insurance Becca's going to talk about. And we do have situations where people do not have beneficiaries in the system. Has anybody had to deal with the death of a loved one and seen what happens if the wrong person got the money? I have many times. It's not pretty. It is your responsibility and yours alone to go into Employee Navigator and choose your beneficiary. Tama cannot choose that for you. She cannot give false information to MetLife in the event of something happening to you. So whoever you have as your beneficiary is who that money has to go to legally. Let's make sure it's going to the right person. I've seen situations where it went to an ex-wife because someone didn't change it. It was $1 million. I've seen situations where it goes to probate court and the courts decide. Okay, so this is a really simple thing. One of the first couple screens in the system is making sure you add your beneficiaries. Okay, so just because we're rolling over your elections, I would still encourage you to go into the system, make sure your address is right, your phone number is right, and that your dependents are there. And yes, you will need their social security numbers.
The also is the basic life. And we've increased, United Consulting increased the benefit from 2,000 for your spouse and 1,000 for your child to 10,000 for your spouse and 5,000 for your child. So that's something Tamara really pushed for, and she thought it was just a great benefit to supply to the staff. But we don't know if you're married or have children, even if you're not covering them on the medical plan. And so they're not in the benefit administration system that we've collected. We need you to go in there, not only provide your beneficiaries, but put those people in there, because how else are we going to know to cover them and you guys get the benefit for you guys? So please go in there and make that update. And then the voluntary life and disability, life and AD&D is if you're currently enrolled, you can increase your benefit $10,000 without filling out EOI. So like without filling out all those medical questions. So if you say you have 100K right now in voluntary life, you can go up to 110 without filling out medical questionnaires up until you get to 150,000 in coverage. At that point, you cannot increase it 10,000 without completing medical questions. If you would like more than that, or if it's your first time electing, you would be subject to the medical questions, and then MetLife will review your medical questions and approve or deny your request. The form for your evidence of insurability or those medical questions are going to be posted in Employee Navigator. There's going to be a link that you can click, complete the form. Tama and the team will be getting after anyone who elects over. It will say pending. It'll pend your amount because you've elected over the amount. And then we'll kind of follow up with you and make sure we've gotten that form turned in so you can get approved or denied for that amount. And then it will be effective.
The wellness benefit.
Okay, and then there's two benefits that you guys have previously had, but I just want to highlight kind of a value add. You guys had access to voluntary accident and voluntary critical illness, meaning you guys pay for it yourself if you choose to cover for accident or critical illness. These are lump sum benefits, meaning that if those occur, if you have a critical illness or if you have an accident happen to you, like, you break your finger, you break your leg, they pay you out, both of those plans pay you out a lump sum for that benefit. So depending on the injury, the scale of the injury, the smaller the injury, the smaller the payout, the larger the injury, the larger the payout for accident. If you go to your primary care, which everyone should be doing because that's covered at 100% due to ACA, right? Everyone's covered at 100% to get your primary care things, but Meritain does not speak to UNUM. So if you've selected the accident plan and you've gone to your primary care, if you fill out a claim form for UNUM saying you went to your primary care, so say your kid plays football and you fill out that, he has to get a physical before he can play. He completes that form, submits it. You can turn in that claim form to UNUM on the accident plan because maybe he hurts himself in football. And so if you cover him on accident, you can get a $50 wellness credit or money back. So you get $50 for wellness on that. You can get for critical illness if you enroll, depending on the tier you enroll in. Family pays 100, employee plus spouse pays 75, and employee only pays 50. So again, if you go do your primary care physician workup, file a claim, then you get $50 for accident if you're enrolled in that, or 50, 75, or 100, depending on the tier you're enrolled in for critical illness. Vision, it is also 100%, this is not new, it's 100% paid for by United Consulting. But an add-on, a value add in that service is hearing. There's a hearing benefit. So you do have to use a specific hearing network. So you'll have to utilize that specific network, but free hearing testing with the vision benefit, that's 100% paid for by United Consulting. And then a very large discount on hearing aids. Hearing aids are very expensive. And it's for everybody in your family. The United Consulting pays for, your family to have vision coverage. So if your child needs hearing aids, they outgrow them. It's very expensive to keep them up. So if those are two great benefits that are add-ons to the vision. You already covered the AP, right? I think that's good.
Cool. For those of you that are in the high deductible health plan, which is one of your major medical plans, you can have like this separate bank account called a health savings account. That's yours. It's your ability to pre-tax and pay for anything you come out of pocket for pre-tax. The advantage now is that you come out of pocket and Garner's going to pay for it. Doesn't cost you anything, right? But it allows you to pre-tax those dollars if you're on the high deductible health plan. And those are just the new amounts for 24 and 2025. Just as a reminder.
Can I ask a question on that, Travis?
Nope, you can't ask any questions.
You said the key words there. I mean, previously there was some disconnect on the eligible accounts for contributions to the HSA. Is the Aetna Choice POS2 plan eligible for the HSA, or is it only the high deductible account?
Yeah, this is an IRS rule, guys. That's a great question. The question was, when do I get to use my HSA account? So the IRS sets these rules, not United, not Meritain, not Arista. Okay, so there are certain things that qualify to be a high deductible health plan. You got one plan, which most people are in, called the National Point of Service Plan, and it's got co-pays for doctor visits, co-pays for things. That's one plan. Your other plan is literally called like the high deductible plan. That's where everything has to go to the deductible first. That's the way that the government designed it. Again, not Aetna. The government said everything goes to the deductible first, but then the premiums are lower. And in theory, for only that plan, you're eligible to put an overlying HSA bank account on top of it so that when you come out of pocket, you can use pre-tax dollars. So the HSA is only available for that one plan. And just to scroll ahead to let you see what it is, it's the plan here right in the middle of the page. It says Meritain HSA 2800 100%. Only that plan right there in the middle is eligible for the HSA account. Okay? This plan over here, the 5,100% plan, that is not eligible for HSA. Okay?
Thank you.
Yeah, great question. The website, we're going to leave here today. I would say 90% of your questions are going to be in this guide, even when we get into the detailed pages. But some people are going to be like, I'm out of town. I don't have all this information with me at my desk or at my fingertips. Everything is on this website. You can scan the QR code. You can go live. Here's just an example of what it looks like. I need to bring this. That tab's right in my way. How do I get over to that? There we go. So there's a welcome page. It's just got more details on each one of your benefits. The details about text care, which we talked about, which is the telehealth stuff. Who is Garner? What is Welldyne? There's more detailed pages on each one of those should you need it. The Pocket Pal is the mobile app, so you can go to the App Store on Google or Android and download the Pocket Pal, and then this information will transfer to there as well. These benefit guides are going to be right there with all the important federal notices that we have to talk about each year. So, and then enrolling in your benefits just takes you right to the Employee Navigator website. Okay. Again, it's going to prompt you. It's time to enroll. It's not there yet. It's going to happen this afternoon. And then all the instructions are also in this book. So that's just the website. It's got way more details on everything. You're going to have questions on Garner. There's like 4 or 5 different one-pagers on Garner as well. So there's more details for those of you that want the details. We're going to go a little bit faster now. We kind of hit on most of the the big changes. I'm just going to hit some highlights. This just talks about who's eligible for benefits and that we're in the middle of open enrollment. Again, open enrollment is your chance to kind of hit the reset button. So starting 7/1, if you want to make changes, now is your time to do it. If you decide not to make changes, the only time you can make changes, again, this is an IRS Section 125 rule that says the only time you can make changes outside of open enrollment is if you have a qualified life event. You get married, you get divorced, you have a kid, something happens to you. So you're thinking about what decisions you want from 7/1 to 6/30 of the following year. Okay. Again, this is just going to talk about a high level overview of your medical plans. We talked about your HSA here in the middle. Again, if you don't want to change anything with your plans, you don't technically have to do anything. We'll make sure that that carries over. But I don't know what number I'm at, probably number 3. You're getting new ID cards. Everything stays the same until 6/30 with what you have, right? Everything stays the same. July 1st is when the move to Welldyne happens. Okay, and you'll see them right on the back of the card.
And log in and make sure we have the right address for you guys, because your new ID card has to come to your current address. And it's
No changes, we still have to go to Medicaid?
Well, you weren't paying attention to my presentation then. You don't have to go in Employee Navigator. Like I said, we'll move your benefits over, but how are we going to know that your dependents are in there correctly to get the life insurance benefit? How are we going to make sure that your beneficiaries are correct? So you don't technically have to, but you're probably going to be missing out on some very important benefits if you don't. Here's a few value-added programs that, the purpose of health insurance is to have it when you need it most. And there are some conditions that are more significant than others. Another thing the organization did a couple of years ago to give back to employees is this Livongo management program. So I don't know if anybody's been touched by diabetes or dealt with it, but it's not necessarily the most fun thing. It's manageable, but things can be expensive. If you voluntarily enroll in the program, you can get access to the glucose meters for free at no cost, which is several hundreds of dollars out of your pocket if you didn't sign up. The glucose strips are free. They don't have to cost you anything. So again, the company is paying for this. It's just we're trying to give access to care and make it easier for people. But also it extends just beyond diabetes to things like hypertension or weight loss. And so if that's a program that can help you, all you have to do is reach out to Livongo and engage in the program. But again, it's not mandated. There's not reports coming back to the team saying so-and-so is using the program. It's only intended with good intentions to help you if you're struggling with something. I do know that there are some people in the organization that take part of this and are benefiting from some of these services. It's just wanting to remind you. We talked about minute clinics. Again, remember the HSA plan? I said the IRS develops the rules and you can't have first dollar benefits except for like a wellness exam. So you have to meet your deductible first and then things are covered by the plan. Well, it's a $0 copay if you're on the copay based medical plan, the non-HSA. So you can go to Minute Clinic again for no cost. This just kind of highlights that. So text care would be first, right? Telehealth, and then you go to the clinics like CVS Minute Clinic and then urgent care. We don't want to just rush to the ER. Obviously, I don't think anybody even wants to at this point. Lion Rock is also a great service, with the exception of anybody that might happen to be in Texas, Maine, Alabama, North Carolina. It provides drug and alcohol addiction counseling, access to outpatient programs if that's something somebody might be struggling with. Lion Rock is an available service. And then lastly, kind of a more comprehensive wellness program is Connect Care 3. So there's learning modules, how to eat better, how to do certain things. You can kind of log on. There's the Mayo Clinic has this cool library. So if you're like me and something happens to you, what's the first thing you do? You Google it, right? And then you get on there and then WebMD scares the hell out of you. And you're like sometimes the information is honestly just not very good. And so things like this with Mayo Clinic, I think we can all agree Mayo Clinic's a pretty credible resource. So just know that there's some things out there for you when you need it most. Going to go a little faster. I'm not going to bore you with every single detail on every page. So remember I said there's a detail page for kind of each one of these benefits. Welldyne starts here on the next page. It's going to go over their website. It has its own app. It's got a member portal. If you want to use mail order pharmacy, things of that nature, you're just going to go to Welldyne instead of CVS. That's the only difference. But when you're going to the retail clinics, like you're going to pick up your prescription, you're going to go to the same places. You're going to go to Walgreens, you're going to go to Publix, you're going to go to, the types of places you want. I will tell you that no two places are created equal. I didn't talk about this in the first meeting, but GoodRx, you probably heard about it or seen it. I went to pick up ear drops for Liam, my son, who had an ear infection. And all I did is I went to Walgreens and I said, how much is it? And they're like, what's your insurance? And I said, that's not what I asked. I said, how much does it cost? Which is a question each one of you should be asking. And I'm going to tell you why in just a second. So I said, what's the cash price? Then I said, well, how much it is through my insurance? Well, who do you have? Well, this is who I have. And then I said, what about this GoodRx? I found out that GoodRx was $50 cheaper for these little drops than it was going through my insurance plan. Now, so there are some disadvantages to using GoodRx because it doesn't count towards your deductible or out-of-pocket max. But I don't know about y'all, I'm not paying $50 more for the same thing. I don't really care if it goes to my deductible or not. Like I don't care because Liam doesn't go to the doctor that much. So just know it. And you've heard me say two things that I always tell people that are the best lessons I've learned of doing this for 22 years. Slow down when you go to the doctor and ask good questions because they're just there to rush you in and rush you out. You got to slow them down yourself. Second thing, the most important thing is where you go matters. Remember we talked about top 25% doctors with Garner. Where you go matters. $0 copay at Minute Clinic, $0 cost for text care. Where you go matters. We don't just want to rush to the wrong doctor or the wrong place. Another example of that's my own MRI from an old soccer injury from college. This right knee is going out on me. What's the first thing a doctor does when it says you have pain? An X-ray and then an MRI. Do you know that nearly all the hospitals own the doctor practices and own the MRI facilities now? Where do you think they're sending you? To their facility. If you have an MRI, it goes to your deductible. Who pays for that? You do. So they were going to send me to get an MRI. It was going to cost me $2,500. I shopped around a little bit, got on and would have wished I had a healthcare blue book or a Garner app at the time. I went to Roswell Open Imaging. I paid $550. Same thing, going to the same doctor to read the same results. Where you go matters. So those are just two easy examples of my own family that I've used. My MRI was like 10 years ago. Liam's thing was 3 months ago, y'all. Like this stuff happens. You have to pay attention, which is why we're trying to give you these tools like Garner so it can help you in the process. But you have to take some responsibility. If we're going to lower the cost of healthcare in our country, we all have to be a little bit more educated into what we can do to change stuff. If we just go wherever we want, whenever we want, right? Which is, you're right. It doesn't mean it's the best thing for you. Does that make sense? That's a little thing on Welldyne. This is really kind of what I was talking about. Where you go matters. Text care, then a retail clinic like CVS, then primary care, then urgent care. Most convenient, least expensive to the most expensive, least convenient at the bottom. Nobody likes going to the ER. There's one pager on text care. There's actually a couple pages. If you scan that right there, it'll go right into your phone book, right on your phone. So this guide is out there on the website. You can just scan it. I encourage you to use it. I've used it. It's awesome. Makes life really easy. There's a lot more details on Garner in here for those of you that want it. And there's more brochures on the website that talks about what if I'm in the HSA plan, or how do I log in, or how does all this work? I'm going to repeat myself because this is probably the biggest positive change we made. We have to use the app first before we go to the doctor, right? Or we're not eligible for the reimbursement, right? If we go to a practice that has multiple doctors, it is your responsibility to add all of the doctors in that practice if you want to be reimbursed, correct? There are 3 exceptions. Do we remember what they are? Primary care, pediatrician, OBGYN. You would have to enter your existing providers. You will have an exception for that. Yeah. Well, at least one of those doesn't apply to this section. And then for the first 60 to 90 days, if you go to the doctor, just remember to save your EOB from Meritain when you get it, or you can get it on their portal, and you'll just take a picture of it, right? And you'll submit it, and about 30 days later, you get the money back. The one exception we talked about, and this is for those of you in the high deductible health plan or the HSA plan, there's a whole page on it right here to tell you that it works a little bit differently. So because the IRS says you can't have first dollar benefits, okay, you have to pay a minimum deductible, and there's an example right here on the screen. Your deductible is $2,800 for individual or $5,600 for family. But if you get $1,000 or $2,000, this is kind of how the math breaks down. You're responsible, you have a major surgery, you pay the $2,800, okay? You're going to get reimbursed after that first $1,600, you're going to get the next $1,000 back, which really means your total out-of-pocket exposure is $1,800 because you got $1,000 back. But you don't always just go have a surgery and you get it all at once. Sometimes you may just have an MRI or something. So the way that works is if the MRI is $1,600, you don't get reimbursed. If you're on the HSA plan, you have to pay the $1,600. Only if it's more than that would you get the eligible coverage. I don't make the rules. I'm sorry, it's a little more complicated, but that's just how the HSA plan. If you're not in that plan, you get first dollar benefit. Okay. Yes, but I can do it again. So for the first 60 to 90 days, you're going to get the EOB from Meritain. You're going to take a picture on the app, and you're going to send it in, and 30 days later, you get the money. That's how this works. It's really not intended to be more complicated, but we are asking for your engagement. This benefit is to help you. And the company is willing to put some money in the pot for you if you're willing to put some effort in as well. And that's the whole intention. Okay. Read it. Yeah.
Yeah, they unmuted themselves. Go ahead. Young Dang.
Yes, just to confirm that both medical plans are eligible for honor.
Sorry, can you say that again? We had you really low.
I'm sorry, yes, I'm sorry. I just want to confirm that both medical plans are eligible for Garner.
Yes. Both medical plans are eligible for Garner.
Okay.
The HSA plan cannot provide first dollar benefits. You have to meet a minimum deductible first, which is on the page we're on right now. If you're in the other medical plan, it is available for $1 reimbursement, just because it's, and this page goes over the IRS and why the high deductible health plan works a particular way. But please reference this page that I'm on right now if you're on the high deductible health plan, because it works differently. Okay, still
So
eligible.
there is
but it
no. Okay, so there is no minimum deductible for the 5,000 plan
no,
if you want to use Garner.
correct. You're eligible for the, and it's a reimbursement. So you're paying first and then you get reimbursed, right? We understand it's not just you get the money up front.
Yes. Thank you.
Sure.
I'm not waiting.
So you're on the $5,000 plan, which is on the far right side of the medical page. And let's say you went to get an MRI and it was $800. Under the HSA plan, you have to meet the minimum deductible of $1,600 right here.
The 5,000 plan doesn't have HSA though.
Yep. So just make sure if you're on that plan that you refer to this page, because the way the money flows is just a little bit differently. For those of you that are also on that HSA plan, you know you can put money aside in the special bank account. I have one of these. So I take money out of my paycheck and I put it into a special bank account. It's pre-tax, it goes in pre-tax, it comes out pre-tax, which means like when I went to go get Liam's prescription, yes, it was $75. I used my special bank card for my HSA card, not my normal SunTrust card, right? And it comes out pre-tax. So that saves you about 20 to 30% in taxes. So if you know you're going to have certain expenses, put some money in your HSA account because it pays for it. This just goes over kind of the tax advantages as to why you would do it. Kind of says a $60,000 a year, person, estimated tax rate of 30% when you add it all in. you know, if you use certain amounts of benefits and you put $3,850 in your HSA account, it's going to save you 1,100, you know, $1,100. So this is real money, and no one can ever touch that account. An HSA account is yours forever. Once you put the money in, it's always yours. No one can ever take it away from you. The basic life, we're just going to highlight the company pays for 2 times your salary to 50,000, and then the new benefit of 10,000 for spouse and child. So why do we want you to go in Employee Navigator? We want you to make sure you put a child, and each screen as you go through Employee Navigator, you don't have to choose full family for every benefit. You can say, I want employee only dental. I want full family vision. I want employee spouse medical. It's like whatever you want, but you want to put your dependent information in there so they have the advantage of the benefits.
Hey, Travis,
Yes.
what's the maximum age of the child that's eligible? 18?
Is this Scott?
It is.
I'm pretty good
I'm
with
guessing the
voices.
kids are way over.
I think it might be up to age 23 or 26. How about we get back to you on that, Scott, so I can say it with assurance?
Yeah, okay. You don't have to get back to me, but if you can get back to others that are
Yeah, we
more-
can just send it back to Tam and it can be sent out to everybody.
Yeah, thanks.
It's at least 18. It probably goes to age 23 or 26 if full-time student is my guess. We talked about you can go in the system and get more voluntary life insurance, which is just term life insurance. Most of what we see is people don't have enough life insurance. The average that most financial planners will tell you to do, and I agree with them, is 5 to 10 times your earnings. That's usually whether it's Dave Ramsey, Susie Orman, pick a financial planner of your choice, New York Life. The difference is we're not selling expensive permanent life products. This is just inexpensive term, right? So, and you can take it with you if you leave. It's based on your age and your income, how much you can buy. It's right in Employee Navigator. You just move the slider and it tells you how much it is. If you're already enrolled, you don't have to answer any medical questions. That's that E of I thing Becca was talking about. If you don't have it and you want to get it for the first time, you do have to answer some medical questions to be approved. You can get quite a bit, from 10,000 to as much as 5 times your salary, up to $500,000. And you can also get coverage for spouse and children as well. But again, the guaranteed part only happens if you're existingly enrolled. A couple of benefits that go kind of under the radar, because most people just care about the medical, dental, and vision and don't pay attention to some of the other stuff, but it's a great benefit, is let's say that someone got injured or sick and, you know, outside of workers' compensation, all you have is like your sick time or your PTO, right? And once that's gone, there's no guarantee of a paycheck, right? And so the purpose of short and long-term disability is to provide income replacement. That's what it is. If you get sick or injured, for short-term disability, it's off the job because workers' comp covers on the job. It basically covers 60% of your income up to $1,000 a week after you have a 30-day waiting period. So if I'm cleaning the gutters at home and I fall and I hurt my back and I can't go to work for 3 months, I've got a 30-day waiting period and I would get 60% of my income for 2 months. Does that make sense? If for whatever reason it was more significant and more severe, the company is invested to make sure that it goes beyond that it could be paid all the way to your Social Security normal retirement age, which for me at 46 is a lot different than someone that's 23 or someone that's 70. Like, our retirement ages are all different. So if something more significant happened, it just goes from short term, which pays $1,000 a week, to paying either $5,000 or $10,000 a month if it moves into long term, which happens at the 180-day mark. So that's usually something where, something bad's happened to you and you're not coming back to work anytime soon. This at least is 60% of your income, which is better than nothing. Doesn't cost you anything. Company pays for it, for both, which is a great benefit because not all engineering firms or all employers offer this. Many offer it voluntary, which means you have to pay for it to get it. In this case, you don't pay anything for it. No changes to your dental benefits with MetLife. You can still click here. Same network, same benefits. Nothing has changed. The biggest thing I would tell you on dental, again, is from a personal story. A few years ago, I went in just to get my preventive exam. They, put the glasses on, you look cool, and then they do the little gun, they put it in your mouth, and they're like, this is your oral cancer screening, right? We've all done that until they pause. No one likes to pause. They're like, can you open back up again? And I'm like, do I have to? And they just saw something in my soft tissue in the back of my throat that they were like, you know, and I don't smoke, I don't do tobacco, but I just don't do those things. So I'm like, well, what could this be? Well, we need you to go see an ENT. Turns out everything's fine. But had I not gone and seen that and I avoided that, something bad could have happened and I'm perfectly healthy. So go get your preventive exams. If you go in network, guess how much it costs you? Nothing. You go in network to MetLife's network, doesn't cost you anything. Now my dentist is outside of the network, so I end up paying like $20 or $30 my cleanings and stuff when I go. But the point is just go. I don't need to talk to this side of the room because y'all pay attention. It's this side of the room that I'm worried about. Same thing on vision. Not only is that awesome hearing benefit, but my daughter had juvenile idiopathic arthritis when she was a kid, which is called JIA. It's just arthritis for kids. One of the things is you have to go get eye exams. Why do you go get eye exams? Because they can look and see the back of your blood vessels to see if something's going wrong. Did you know that actually those high-powered lenses, they can actually detect diabetes in people just by an eye exam? So people, if you are diabetic, you're probably familiar or know people that are familiar with the eye exam, but it can actually do a lot to prevent things. So, you know, and again, vision is paid for by the company. If you go in network, it costs you $10 to get an exam. I know you got to leave work. I know you got to go get your kids out of school. I know that it's a pain in the butt, but I'm telling y'all, don't be the victim 6 months from now when we could have avoided something now. And I'm saying that out of my own experience. I'm not preaching at you. I'm just telling you that an ounce of prevention can go a really long way. And the company is trying to remove as many of these barriers for you as you can. Paying for text care, paying for the minute clinics, paying for Livongo for the diabetic test strips, right? They're making a huge investment in you guys to make things easier for you. You know, paying for your vision insurance, et cetera. And so take advantage of that. These are a few more details on superior vision for those of you who want to learn more about it, where you can get LASIK surgery and all those things, because I got LASIK surgery. I'm learning that at 46, your eyes change. LASIK doesn't last forever. This is one other thing we talked about before. The EAP program now has gone to 5 visits instead of 3. The lady that just entered the room is the reason why that happened. This talks more about all the different ways you can use it, from work, family, daycare, adult daycare, stress, mental health, all kinds of things. That page got flipped. Critical illness. We talked about what critical illness is essentially is a lump sum benefit. So if you go your medical plan, you had a major cancer, heart attack, stroke, something major happened. This is like Aflac benefits, but they're just less expensive. So like, you know, it pays you back if you just file a claim. That's what accident and critical illness is. Accident pays for more minor things, cuts, lacerations, fractures. Critical illness is reimbursing you for more significant things, cancer, heart attack, stroke. That's how they work. And then the instructions on how to enroll. You really don't need them. Again, roughly around noon this afternoon, this email is going to come out. Look for it. These are the instructions if you feel like you need them. And then because we all need more apps in our lives. Obviously, these service providers had app. The one that I would tell you is probably the most useful of all of them, in my opinion, is the Pocket Pal app, which is basically our website in a mobile version, because that becomes a single place for you all to go to. It's also when we send you the text communications that come out about your benefits, we're redirecting people back to the website. So that's where we're going to house all the information, the claim forms, things of that nature. And then I'd probably, if it was me, I would download Meritain and Wildine and all of them, because it's just how I work. I spend more time on my phone than I do my laptop. That's just me personally.
Question. The dependent life insurance is age 19. If you're just any kid, is up to age 19. If you're a full-time student, it's up to age 26.
Okay, there you go. Any other questions from the?
We still have teledoc in addition to text care. No.
So teledoc will end, as will Healthcare Blue Book, on 6/30 of 2024. Nothing's changing with Healthcare Blue Book. Nothing's changing with teledoc until 7/1. Okay, effective 7/1, it will become Text Care instead of Teladoc, and instead of Healthcare Blue Book, it will become Garner on 7/1. Okay? Good question. Anybody else in the room? The zero cost dollar option is CVS, but I mean, I've been to Piedmont's Minute Clinics. It's just not free. I have to pay something for it. So you still have access through the network. It's just that there's an incentive to go to CVS. That's all. Sure.
And how it impacts the out-of-pocket max.
Because this has come up before. We put this nice little note with some stars, and you'll notice the HSA has 1 star at the top, and the Meritain $5,000 deductible has the the double stars over there. So non-embedded deductible means if you have other family members on the policy, the overall family deductible has to be met first. So I have Sally and Liam and Chloe, which is my full family. I have to meet on that plan. I have to meet the full family deductible, the combination of us. Okay. The plan on the right has what's called an embedded deductible. Sorry to be so technical. This is where the insurance language does become a little bit helpful. Embedded deductible means if you have other family members, each member must meet their own. So for example, you have a $5,000 deductible and a $10,000 family. But let's say Sally had to have surgery and the surgery was $5,000. Once she meets her $5,000, everything else is paid 100%. Doesn't matter if Liam and Chloe and I spent any money. Okay. So we have our combination on the next 5,000. But if you're on the HSA plan, that $5,600 deductible, everybody has to go in together, whether it's Sally or me and Sally or me and the kids, whoever gets to it first, you have to meet that full. This really only applies to the family, people that have full family coverage or spouse or dependents. It's just the way that how you meet the deductible, how fast. That's all that means. Anything else?
No,
That
I'm
was
just
it?
typing.
Okay.
Does copay goes into deductible?
Does copay go into deductible? So let's just talk about the plan on the far right for simplicity. There are things that go towards deductible. Those are going to be things such as MRI, surgeries, inpatient, outpatient services. That applies to your deductible. Okay. Copays are things that you don't have to meet your deductible first. It's just a flat dollar amount. So if I want to go see the doctor, just a regular primary care doctor, I just pay $25. If I want to go to a specialist, I just pay $50. If I want to go to urgent care, I just pay $75. I do not have to meet my deductible first. Okay. On this plan on the right. Same thing with ER. I just pay the $500 copay. It's just a fixed dollar amount for those things. Same thing with prescription drugs, right? Prescription drugs, tier 1, I just pay $10. Tier 2, I just pay $35. Tier 3, I just pay $60. It goes to the overall out-of-pocket max, not the deductible. So in any given year, let's say you had a really bad year, had to spend a lot of money on health insurance. The most you would ever have to spend in a given year is this thing called your annual out-of-pocket max. That combines your copays and all these fancy insurance into one number, which is a high number, I realize, but this is the maximum amount that you would have to do in any 12-month period. And the 12-month period of time is July 1st to June 30th. It's not calendar year. Good question.
Yeah.
What's that mean? I can't see it.
Young, can you unmute yourself and ask your question? I don't know if he has his hand raised. All right, any other questions in here?
Maybe switch from like embedded to non-embedded, like in middle of the period.
You remember open enrollment, which is now, is your time to stay. I want to stay on the same plan or I want to move plans. Only one exception. You have to have a qualified life event. Again, this is not Tama's rule. It's not Rez's rule. It's not Travis's rule. It's not Meritain. This is the IRS's rule. To pre-tax your premiums, you have to make a one-time election and you have to keep it for the whole year unless you have what's called a qualified life event. You get married, you get divorced, you have kids, then you would be able to make changes. Great question. Thanks for being a fun audience. We recorded it. We're going to get this recording over to Tama. That way, if anybody wants to go back and refer to it, or we have new hires, there's information there. Right, so all this.
Hey, Travis.
Yes,
So I had my mic mute. So if I have the 5,000 plan, do I need to meet my minimum deductible first before I can go to CVS
no. So
medical care?
there are services that apply to your deductible, and there are services that apply to just copays. So if you go to a primary care specialist, urgent care, or ER, you just pay this fixed dollar amount over here on the screen, 25, 50, 75, 500. Same thing on prescription drugs. If you go to your primary care doctor, you're going to spend $25 and he's like, you need a Z-Pack. So he's going to send you to CVS. You're going to pay $25 for the doctor visit. You're going to pay $10 for the Z-Pack. And that example, if you're on the $5,000 deductible plan.
No, I'm sorry. If I want to use CVS Minute Care, do I need to meet the minimum deductible?
No, not on the, no, there's no deductible. It's $0. We've waived that.
Okay.
On the $5,000
Thank
plan,
you.
there's no cost for the Minute Clinic.
Okay. Thank you.
Some of them can, not many, but some can. It depends. It's usually more acute types of things like cuts, bruises, scrapes. But I can tell you Piedmont has an x-ray machine in the one we went to because I had to go there. Yeah. If you go to CVS, I think we all know at this point in our lives, nothing in life is free. As I said before, the company is making the investment in you to make coverage easier and less costly for you. The company is paying the cost of that visit. You are not individually. What?
Vaccinations.
Vaccinations? Yeah.
Yes, I do.
Yeah. You can do your wellness exam. You can do your exam there. You can do your annual exam. I've typically gone. You can do your kids' sports physicals at Minute Clinics. Yeah. Again, they're not all of them are exactly the same. So I know that one of CVS's initiatives as a company is that every single one of their facilities is going to have a Minute Clinic. It's not there yet. Do you also know why Amazon bought Whole Foods? And no, it's not for $6 organic milk. Partially it is for the ability to do returns and have access points for that. But the main reason they did, and if you read it, they're going to be putting clinics in all the Whole Foods. Walmart was putting clinics in all the Walmarts. You see them now. They've got dental, they've got vision. So it's called vertical integration. They're all kind of moving towards making access to healthcare a little bit easier. So they're going to expand these services over time, but I don't. Yeah.
Services than just there was traditional Minute Clinic. If you go to the traditional Minute Clinic, they're only going to be able to do acute care, like the minor things. You have to go to an enhanced Minute Clinic, if you will, to get some of the other services.
And to add on to that, let me just say that we are working very hard here at United to make it so much easier for healthcare for all of you. We are now working on mobile services here at the office. We're going to have mobile dentists come here and be able to get your cleanings, simple fillings. We're working on now bringing mobile vision services here, hearing services. So you will be able to come to work and have all of those services taken care of right here in the office. So we don't want you to leave. It's so much easier. And we all know how great it is. He wants you to be healthy. He really does. And that's why he just spends as much money as he does to make sure we're all healthy. So we're trying to make sure that we encourage you to go to those visits and use those preventive care visits. So we're trying to make it as easy as possible for everyone.
Yes.
So does it offer any like blood test or like free blood?
The blood test at, CVS, let me look at
I don't know if they do lab panels or not.
They do not.
I don't know. I don't know. I don't know if they do lab panels. Yeah. Where?
It goes to like deductible, right?
What are we looking for? I don't see it. I don't see.
So whatever we pay, like it goes to deductible. Whatever we pay for like blood test or anything.
Well, no, the affordable, so this is important. Actually, thank you for asking. The question is, you know, if I go get an exam, is this all covered? The Affordable Care Act is a federal law. It is very specific on what it does and does not cover. Again, Tama didn't decide this, Travis didn't decide this, Meritain didn't decide this. The dance party. Exactly. So with the premise of nothing in life is free, right? Because it's still, there's a cost for it. It just doesn't cost you anything. If you go get your preventive wellness exam as defined by the Affordable Care Act, I'm going to get into all the exceptions about what that is and isn't between female, male, all of that. But if you go do that, then it should be at no cost to you. If you go to a primary care doctor and you're just getting your wellness ACA exam, it should cost no cost. Now, let me be really clear on one other thing, because I learned the hard way too. You go in there and all of a sudden they do a diagnostic test for something completely different. It's no longer free. The whole thing costs you money for the lab panels, for the doctor visit, for everything. So when you go to get your preventive exam, you are only there for your preventive exam, or what happens? You get charged for all of it. Okay?
They can change the coding for that whole visit to, they're now diagnosing your token, or, you know what I mean, like, so just. Watch it. I know they ask you, and they want to be well, but it's telling you how they code it.
Folks in. Whatever you want.
Just truly make another appointment, like, if you're going there for primary care, get the age appropriate, gender appropriate, like, care you need in your primary care. I know it's a pain to make another appointment if you happen to be sick at that time, but if you truly want it $0, you're gonna have to like go for two different, one's gonna be diagnostic of whatever your issue is, and one's gonna be the preventive care visit. So you just have to kind of keep them separate, or else you're gonna be charged.
For those of you that asked for what does CVS do, I just got on their website and clicked it. And it says they cover 195 different services, from vaccines, illness, infections, sore throat, strep, injuries and pains, skin, hair, and nails, sleep disorders, chronic condition management such as high blood pressure, diabetes, tests and screening, physicals, men's and women's health, behavioral health. So it's going to vary depending on the location. But you can just go on their website, type in the location, and it'll tell you what they do. Yep. Yep. And which location you go to. Like some of those places are like one little tiny room, and some of them are much more, like one in Buckhead's a little bit more elaborate. The one in Smyrna is a little bit smaller.